Hi, I'm Dr. Alison Grimaldi, and today we'll be talking hips. What do your patients most look forward to once they've finally made the decision to take the leap into a surgical solution for end-stage hip osteoarthritis? Pain relief, right? Of course, there are many functional and quality of life ambitions, but these are usually inextricably linked with relieving the pain of advanced arthritis. Failure to achieve adequate pain relief can be devastating. While overall total hip replacement is a highly successful procedure in appropriate candidates, the incidence of persistent pain following surgery has been reported to be as high as 40%. Most causes of postoperative pain following joint arthroplasty can be encompassed within Brown and colleagues' 4 I's: wrong indication, postoperative infection, instability and impingement of soft tissues. Then of course there can also be comorbid conditions like tendinopathy that won't be solved with a joint procedure. It's important for non-surgical health professionals to be aware of potential reasons for persistent postoperative pain to help their patients negotiate what can be a very distressing situation. Read more in my blog about one of the most common causes, iliopsoas impingement. Thanks for joining me, and I'll see you on the next episode of Talking Hips with Dr. Ali.